All right. So, right, if you have the kind of, information about disease that we are just talking about, you can start to explore, the statistics of the information to figure out, where you might expect to see disease pop up next, right? So you can build all sorts of geostatistical data sets, pulling information in about where people live, where disease comes from, landscape information, climate factors. You can detect clusters and patterns that start to see where this information combines to create kind of the perfect storm for a disease to occur. You can, look at how that's changing over time and space. You can even set up, right? If you understand the disease well and you have all this data, and you can start to actually create a statistical analysis that says we have the right conditions. We are within a percentage of, where we would expect to see an outbreak, right? So you can actually create a model that starts to ring an alarm bell when you have, the perfect storm of conditions to expect an outbreak. Okay. Right, so people use GIS to look at spatial diffusion, to analyze and predict flows of disease transmission, right? How people move, how disease moves, right? How a flu might move through interstate flight data. Remember, we looked at that bad map earlier where it was just a map of all airplane flights in the world, right? That was not all the diffusion of the disease, but that flight data can be used to start to calculate ideas about how disease could move through transportation systems, whether that be flight movements or road travel, or people moving in and out of busy areas, schools, festivals, etc. And that can then help you target and create an intervention, right? And if you're actually using the health data that's available, it'll help you make good decisions on whether to shut down schools, on whether to shut down borders. Right, so this can help both plan, it can help model the disease, it can help better understand the disease. So this is a picture from the New York Times article I posted, mapping of the social network of coronavirus, right? And so it's an interview with a gentleman who works for a modeling company that's thinking about, right, social networks of how people move, interact, and travel, to help think about how this disease is moving through our population, right? And the story talks about like how historically scientists try and anticipate the trajectory of infectious diseases focused on properties of the agent itself, meaning the disease itself, right? Like the level of contagion and lethality, right? So those are both really important components. So how hard is it for the disease to move from one person to another? Is it airborne? Does it come from breathing the same air? Does it come from touching? Does it come from, liquids being exchanged, right? So thinking about how it moves, how it gets contracted is an important component, as well as then how many people that are exposed to it die, right? And those are both really important. But another important factor is vectors. People as vectors, whether dogs are vectors, was the question, is whether dogs could contract coronavirus or not, right? So then they discussed how in the past decade or so, leading investigators have begun to incorporate social networks into their models to try and identify and analyze patterns of individual behavior that amplify or mute potential pandemics, right? So the disease, it's not just about how the disease functions, but people are the vectors that transmit the disease. So it's very much dependent on how people function, how people move, how people interact, which is why we're seeing, right, the call for social distancing, for self-isolation, for the, slowing down of transportation of people from one country to another, because that is a really important component to how disease spreads, not just how the disease works, but how the disease vectors, which in this case are humans, move, interact, how close they stand to each other, what surfaces they touch, what airplanes they get on, right? So all these things have become really important components to help model this, which then are, you know, supposed to be used for making these big public policy decisions of how we can respond by closing down schools, you know, by banning groups, large groups of people, right? So these are things that help slow the virus's transmission, which then eases the burden on our medical infrastructure. Right, and so modeling not the disease itself, but the behavior of the human host is a really kind of new way of thinking about modeling disease. And so, you know, this map on the right is different than the flight map, but is starting to map the network of human interaction, right? How people have, you know, shaken hands with other world leaders, for example, as we've seen, you know, people trying to track how coronavirus is moving through Mar-a-Lago to, you know, some of the president of Brazil, Bolsonaro's, you know, personal aides, and how one of his cabinet or personal aides or somebody in his group, Bolsonaro's group, did contract coronavirus, right? Right, and so being able to model how humans talk to each other, how they touch each other, can help then inform policy recommendations to prevent them from doing that, prevent them from shaking hands, prevent them from coughing into their hands and then touching doors and stuff like that, which hopefully people have stopped doing, right? We're also seeing, you know, bars closing, or, you know, bars and restaurants reducing the number of people they're letting into their shops, so that people sitting at a restaurant are sitting further apart from each other. Or, you know, and if that's not working, then we're seeing a shutting down of bars completely in, right, Italy already, but also Spain and France are also shutting down all, you know, all shops and businesses that aren't grocery, that aren't pharmacy, that aren't banks. I'm pretty sure we can expect to see that here in the coming weeks. Right, so World Health officials are using these types of social network modelers to help them better understand the spread of disease, and they're consulting them on a daily basis, right? That helps them make the decisions about when it's appropriate to shut things down, whether it's too late or whether it's too early, right? So they know the appropriate point to make the impact of when it's right to shut down a school or shut down a border. Okay, right, so GIS has often been underutilized, right? It's so powerful to help make decisions and help, you know, prevent more deaths when we see an outbreak. But people are starting to figure out how to use it better. That, you know, now that you have some understanding of it, that when you go out into the workplace, you might be able to help your company solve a problem, or whatever institution you work for, solve a problem by making, you know, looking at it spatially, by adding spatial data, by, you know, that might help you solve problems wherever you work. So keep that in mind, because it has been underutilized quite a bit. But it has all sorts of potential for, you know, disaster response, whether that's epidemiological research, communicable disease control, health service planning and optimization, or, you know, many, many other things that it can be useful for, right? Just a couple examples of how this is so important for coronavirus, the ability to look at how many hospital beds are available. That once, you know, you can map hospitals, but you want to know extra information about those hospitals, you know, which ones have certain emergency services, how many beds are available, how many beds are not available at that hospital, how many respirators does that hospital have, is going to be really important information moving forward, right? And then as you start to see, you know, hospitals become overburdened in a certain region, right? Maybe in the city of Boston, for example, that then you could also map out what are the closest backup hospitals, what beds do they have available if you have to start busing people further out to places that are less impacted. Or, you know, as Governor of California, Gavin Newsom, has recently made a declaration that the state of California will now have the right to commandeer hotels to create emergency service areas to open up beds, right? So that hospitals will be able to also offer services, offer more beds through the state taking over hotels to be used, right? And so that's, being able to put that into GIS is going to help people respond and save lives. Other information that's also right around services, the ability to provide them during an emergency, knowing how many ambulances or fire trucks or firefighters are available, what their response rates are to certain neighborhoods, right? And during the California fire, we flew in firefighters from Australia to come and help, fight the Paradise Fire, for example. Okay, I want to give you one more example of, how disease moves, and humans are not the only vectors. Mosquitoes are an extremely common vector for transmitting diseases between animals, between human animals, and because they have their dirty little stinger mouse and their little bloodsuckers, right, that they cause hundreds of thousands of deaths every year through multiple different diseases that they transport. And so understanding how to model the life of a mosquito can be really important to helping prevent some of these diseases, right? So mosquitoes are responsible for West Nile virus, dengue fever, encephalitis, chikungunya, which is kind of a new one on the scene, at least for us Americans to be hearing that just in the last 5 years or so. Zika virus, also something that came into the American consciousness just in the last maybe 5-6 years. And then malaria, which has been around forever, which has decimated armies, right? Malaria is a terrible disease that kills many, many people around the world every year just through a simple mosquito bite. That could also be prevented through mosquito nets. The Bill Gates Foundation does a lot of work in providing, mosquito nets to people that are prone to mosquito-prone areas, largely in sub-Saharan Africa. That a $7 mosquito net could save their lives if they sleep under the mosquito net. That would prevent them from getting bit by these mosquitoes. There's a couple different main mosquitoes that are responsible for these diseases here on the bottom. I'm most familiar with that striped one, that jerk, the Aedes aegypti. But there's also then this Culex dude who does not have the stripes, that also is prone to transferring these diseases around quite a bit. And so, right, in order to understand how these diseases get transferred and move around, you have to understand the life of a mosquito and what its needs are. Right, and so I'm sure all of y'all have had interactions with mosquitoes. They are the worst, right? They make that horrible high-pitched buzzing in your ears. It's right around summertime when you're super excited to go out in the world, to go camping, to go to the woods, that mosquitoes like to party as well. They come out of their shell and bite you, make you itch. They suck your blood. It's all around just terrible, and they're very rude, right? But what mosquitoes need to be alive is they need, so many days of temperature above, I think, 60 something degrees, right? So they come out when it's warmer. So we know that there's a seasonality to their ability to infect. They also need water, not just any water. They need still water or slowly moving water, like puddles, like calm ponds, like bits of rainwater trapped in a bottle cap, right? That or rice paddies, right? All sorts of places, swamps where water sits and it's warm-ish, right? That mosquitoes find that water, they lay their eggs in it. It goes through several disgusting larva stages, and then pupa, and then it eventually becomes an adult where it can fly out of the water. And actually that usually happens fairly quickly. It's my understanding that they really only need about 3 days for them to go through that egg laying to adult process. Because in Arizona, right, where there's quite a bit of mosquito issues, in the summer, right, it's a desert, so water evaporates fairly quickly. But in the summer, they do get monsoon rains, and so it'll rain really intensely, fill up puddles, fill up ponds, fill up any depression of the ground, fill up any bit of garbage or old, planters or buckets left out in the yard. Put a couple inches of water in there, and then before, even though the next few days are 110 degrees, that the mosquitoes can breed before that water evaporates. So it really only takes them a few days to get in there and produce a bunch of more disgusting jerk mosquitoes, right? And so if we know a little bit about what a mosquito needs, we can start to model where there's water, where the right temperature exists, where human populations exist near what, where mosquitoes tend to breed. Right. And so Arizona has been fighting mosquito issues for a long time. And what happens, right, they try and prevent mosquitoes from breeding, right? So they try and make sure that people dump out any place in their yard where water might collect, that they turn over buckets so they don't collect water. And so they try and prevent mosquitoes from being able to breed in the landscape, especially in the urban landscape, which is where you'll find a lot of people, and therefore you want to prevent mosquitoes from being there, right? So this is an example of what happens for West Nile virus because it is a public health threat, that the Arizona Department of Health Services collects data about how many people are infected and how many confirmed cases they have. And so if someone gets sick and goes to the doctor and gets tested and they get test positive for West Nile virus, that data is mandatory reported to the state health department, right? And so 2015 was the year that I got West Nile virus, living in downtown Tucson, Arizona, where people left their ponds or their buckets open, and water collected, and mosquitoes were breeding in downtown, which happens all the time. And one of the infected mosquitoes bit me and gave me West Nile virus, which means for several months I was, I guess I had a fever at some point, but I was mostly just really low energy, sick to my stomach, felt pretty gross for a couple months. And then finally I went in and they tested my blood and said that I had West Nile. There's nothing they can do. There's no, cure for it. You just have to kind of, rest and power through it. And so, I'd already, being a grad student, I felt kind of crummy all the time anyway. And so when I went in, it was already pretty much run its course, but they reported me to the state health services, right? So I lived in Pima County, which is where Tucson is. So I'm one of these cases here. Maricopa County is where Phoenix is. They have a lot of cases up there, right? You can see there's other data that they're collecting about who caught it, what other diseases they had. And this helps them try and prevent future outbreaks and try and reduce the number of mosquitoes, right? So after I was reported, then the Department of Health Services came to my house and put in a mosquito surveillance pool in my yard. And what this is it's just a little cardboard box with dry ice in it, right? Dry ice is just frozen carbon dioxide. And mosquitoes are drawn to carbon dioxide because that's what mammals exhale, right? So me and you are breathing in oxygen and other things, and then we exhale carbon dioxide. Mosquitoes get a whiff of that and know that you have some delicious blood in your body and they come for you. You can mimic that by using dry ice. They smell that, they go and get caught in the trap and die. And then the health department comes back and collects their traps and sees what kind of mosquitoes you have in your yard. If you have the Aegypti, that striped one, which we know is a carrier of West Nile. So they count how many you've got, and then they test to see if the mosquitoes have the disease in their body. And then they start to map where they see mosquito pools that have tested positive, where the mosquitoes have it. They also have just the number of pools that they use for surveillance, right? Here's Tucson, Here's Phoenix area. And then they can also map the human rates of West Nile virus, right? So the choropleth map here in the background, the shades of orange, are how many people got sick from it. Of course, yeah, we know that West Nile is seasonal. You can see it right here in Tucson. It gets pretty warm early on there, and so they tend to see it from May all the way through. It starts to peter out in October, right? So they have a pretty long mosquito season there, and so we know it's seasonal. We know what happens where there's water, and so they can start to use strategies about tracking where the disease is, how mosquitoes live, to help prevent it. And so both Phoenix and Tucson have pretty important mosquito reduction projects. Tucson does it mainly through trying to reduce standing water in people's yards. And you can actually call in their hotline and report your neighbors for having, like, you know, empty plant pots or buckets or a pond that's left open that's collecting water to help prevent mosquitoes in your neighborhood. Phoenix has a different program where they just drive through neighborhoods and fog it with mosquito poison, right? So both of them still have a lot of mosquito-borne diseases though. All right, so just one last example here of mosquito-borne disease that, I don't know if y'all remember how intense the Zika scare was just a few years back, that Zika is a mosquito-borne disease that lives in tropical regions where mosquitoes like to party. And there was a huge outbreak of Zika in Brazil and the region there, where, you know, one of the main issues was that if a pregnant woman got Zika, that it led to deformalities and quite a bit of deaths in the babies, right? And so people were very concerned about this disease. And one of the concerns was that if someone traveled to the region that had Zika, got bit, had it in their blood, didn't have symptoms, came back to the United States, got bit by another mosquito, and then that mosquito started spreading it around. So an important map to make was, you know, some of the major variables to consider were here, right? We looked down at the legend, the estimated monthly average arrivals to the US from countries on the CDC Zika travel advisory, right? So the size of these dots on the map represents how many people are coming in from countries that we know have Zika, right? So that's the size of the dot. Then, right, it doesn't really matter if those people are flying to Seattle, because Seattle doesn't have a lot of mosquitoes. It's cold and rainy there all the time. It's just not, it's not really warm enough for mosquitoes to hang out too much. And they haven't, they don't have the, they do have mosquitoes, but they don't have the Egypti mosquito, right? So the Egypti striped mosquito hangs out in warmer temperatures. So then the second part of this legend, the color is representing the potential abundance, you know, during the peak season of July of this specific type of mosquito that we know moves Zika around. So that Egypti mosquito. So the dark red then is a high number of these mosquitoes, orange is moderate and yellow is low. So we can compare, like Los Angeles, for example, has a pretty large number of people flying into that airport from places that have a Zika advisory. However, they don't have a lot of these type of mosquitoes in July. On the other hand, right, Miami has both a lot of people flying in and a high abundance of those mosquitoes, right? So you combine those two together and you have a problem, right? So Miami and Orlando and Florida in general was a real concern that this Zika virus might spread. Okay, just the last couple slides here. I feel like I've been talking forever without just talking to myself. It's awkward. Thanks for bearing with me, everybody. So just a moment on the limitations of GIS, right? It's so powerful and so important and can do really amazing things. and, right, save lives. It can save lives in emergency response. But it's not everything. There's problems. And part of the issues that we run into with GIS can be communication gaps between the people creating the data and the people using the data, or people producing visuals and people reading the visuals. That one of the issues we run into are data standards, how the information is written down in a spreadsheet or in a shapefile, right? And how data is reported, recorded, and typed out, right? So if an address is written with a slash or a space or a dot, that's going to give the GIS problems. It's going to not recognize that those are the same things, right? So when we had this problem when we were trying to import county data for, Wyoming, that, one of the records reported the counties as just the name of the county, and another data record had the name of the county plus the word county behind it, right? And GIS could not recognize that that was the same information. And so you had to go in and, use a different data record to consolidate that information, right? So that can be a real problem, especially if you're in a hurry when you're doing some kind of emergency response. To run into problems like this can be a real challenge, and different government bureaucracies have different standards for how they record data, right? So you might have a hard time with, the CDC talking to a hospital, or the CDC talking to, USGS or NOAA, right? That all these institutions don't have standardized ways for recording data. You might have data at different aerial units or enumeration units, right? So maybe you have the state of California trying to deal with city or county government offices, right? And so maybe their data is stored, in different enumeration units. And so you have to figure out how that data is going to be talking to each other, right? So there's all sorts of kind of trip ups around data that can cause problems, especially in an emergency when you're trying to hurry. There's also issues around privacy, right? That especially when we're dealing with disease, that our health records are private, that there's the, HIPAA, which prevents my health data from being reported, right? Because not only is it, my body and my information that, shouldn't be shared with just anyone, that there's often there's different ways that people view disease, that, certainly people get harassed or looked down upon for having certain medical issues, right? And so we have to be sure to protect people's privacy. And so when I get mandatory reported for having West Nile virus, I just told you all that I had it, so it's fine, it's no big deal. But, right, if, because that was data that was aggregated over the county, that it would be really hard to find out unless I told you that was specifically, that I was one of the numbers on there, right? This becomes a problem when you get into smaller aerial units of, maybe a small neighborhood. If you're spatial aggregation, you're only collecting neighborhood data, that data's, over a small enough area that it might be easier for people to identify whose, health data that is, and that becomes a privacy issue, right? So people making these maps have to think about protecting the people whose data they're representing, and that's something that's really important to consider. Okay, I'm gonna skip the summary, except just to say GIS is useful for all this stuff. For next lecture, I'm gonna talk about logic and operations using the and or functions in GIS, which is gonna be useful for our next lab. I hope that these videos work okay. That's the plan going forward. We're all just doing the best we can here given the circumstances. So I appreciate you bearing with me as we work out the kinks to do this the best we can. And take care of yourselves. I'll talk to you soon. Okay, bye.